So, greetings, friends and followers. This is Nurses Talking, and I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I'm very pleased to welcome Dwight Barrett out of Canada. Dwight is a critical care nurse with over 12 years' experience in ER, ICU, med-surg, and mental health. And currently, he's working on a master's in nursing, focusing on health policy and leadership. He says his goal is to help those who are in need, but also to mentor, teach, and help future students who want to pursue a career in nursing. He works as a clinical instructor and lab instructor for nursing and personal support worker students. He's currently the communications executive for the Black Nurses Leading Change through the Registered Nurses of Ontario Association. And Dwight is the author of a mystery suspense novel, Double Deception. And he's working on two more mystery novels and an autobiography. So, welcome, Dwight.
Thank you for having me. I'm excited to be here.
I'm excited to have you. I said all of that. I read all of that because you're a busy guy.
I am. I am. I don't know how I do it. Everyone asks me how I do it. My wife is like, "Do you love me anymore?" I'm like, "Of course I do." But
So, what inspired you to choose nursing as a career?
what inspired me to do nursing as a career? Well, basically, so long story, not really long story short, it is kind of a long story, but I'll try to make it short. So I always wanted to do medicine. Medicine was
Okay.
always my thing that I wanted to do. I remember when my mom came up here to Canada, she wanted to do nursing, but she never really got the connections to help she did. So she had a lot of medical books and like medical encyclopedias and stuff in the house, and I was
Mhm.
always reading about it and so forth. And I just enjoyed it. It was something that I wanted to do. So in high school, I kind of focused myself to kind of gear into like sciences and medical school. So in high school, and I'm going to age myself because this was in the 90s, there was a program at U of T, University of Toronto. It was a summer
Mhm.
mentorship program. And this summer mentorship program was specifically geared for Black students and First Nation students who were interested in health sciences. So I did it for the summer, loved it. I got to go to different places. This is me at 16 years old. I'm going in to see surgery. I remember seeing I saw hysterectomy, I saw colonoscopy. I was at a doctor's office. Like I just got exposed to a lot of stuff. So that kind of cemented me and said, okay, fine, you know what? I want to do medicine. So graduated high school, started university. Um, my first degree, it's psychology, but I originally started as kinesiology. So I
Okay.
was like, okay, fine, let me do kinesiology. But then the school had a strike, and at that time too, they changed a lot of the parameters and protocols and the requirements. And I just said, you know what? I just wanted just to get my degree done and out of the way. So I ended up graduating with a psych degree. And then I said, okay, you know what? I still want to do medicine. So I took an MCAT like prep exam, and then I thought, okay, fine. I never did organic chemistry. Because I've heard horror stories about it. So I thought, oh, I'm going to be big and eager and I'm going to self-teach myself organic chemistry. Don't do that. Don't do that. Don't do that. Um, I learned the hard way. I did
Yes.
the MCAT, and the MCAT was, yeah, it was very challenging for me. But also, too, I was like, oh, let me just do the MCAT and let me just see how it is, and I could do it over again, like as a practice run. No, no. So, that kind of made me like open my eyes and be like, okay, fine, maybe I need to start looking at my options. While all that was happening, I was actually working as a pharmacy technician. So I always said to myself, well, you know what? If I don't become a doctor, I'll become a pharmacist. At this point, I was working as a pharmacy tech for over 10 years, and I respect pharmacists. I really do. I think they're great. It's a great career, but I personally don't think they don't get the respect that they do because there's so much
Hmm.
schooling that they need to
Yeah.
learn. And from me working with pharmacists, I was like, nah, I just was not like, I just thought, nah, maybe I shouldn't do this, right? So again, I started looking at my options. So one thing that really intrigued me was now you guys have this in the States, but we don't have this in Canada. We have something similar. It's like a nurse anesthetist. So up
Mm.
here they
Yeah.
have they call it Anesthetist assistant. That's what they call it up here, a
Okay.
nurse assistant.
Okay.
So in order to do that, you either have to be a nurse or an RT, a respiratory therapist. So I was like, okay, this is really good. I like this. This seems very interesting. Maybe this will be something I'll get into. And I remember originally when I thought about nursing, I was like, nursing, I don't know about that. Because I was very narrow-minded. I thought, I was still thinking bedpans and all that
Mm-hmm.
stuff. Like I was very narrow-minded. And it was a pharmacist who I work with who basically told me, they said, Dwight, don't be an idiot. Stop being a stupid idiot. There's guys who work into nursing, those stereotypes that you hear about guys in nursing, it's not true. Just do it. You have a warm heart. You love working with people. I see you all the time. You're a joy to work with. Just apply. So I said, okay. So I applied to the nursing program and I applied to the RT program. Got into both of them, but because the RT program was already full, I would have been deferred to the following
Yeah.
September, which means I would have
Yeah.
waited a year. And I'm like, I don't want to wait a year, right? So I got accepted to nursing school. So I said, okay, you know what? Let me go into nursing school. I got in. And now I did have the option of doing my nursing um the either 4 years or I can do it straight 2 years, like throughout the
Mm-hmm.
summer because I
Yeah.
already had a degree. I said, you know what? I'm playing with people's lives. I really want to know what I'm doing. So let me take the 4 years. I can have the summers off. So I did that. What I will say doing nursing school, what really changed me was I remember in second year, I was on a cardiology unit and my clinical teacher said, hey, do you guys want to see the ICU? And we're like, okay. So we walked into the ICU and I saw a bunch of guys there. I just assumed they were docs or some type of specialist because everyone's wearing like their scrubs and everything. And
Yeah.
I'm seeing all these patients like, on
Hooked
ventilators
up.
and all
Mm-hmm.
these drips and stuff. So I was like, okay, whatever. And then I found out all these guys were nurses. I was like, yo, this is kind of cool. I would love this because these patients are like they're on life support
All
as
kinds of. Mm-hmm.
as we like to call it, but they're on all these IV drips and everything. I thought this was really cool. So I took that experience and that moment. I thought, you know what, I want to get into that. So I did my nursing, graduated, got into a merge because a merge was something that I was also very eager in. I was an extern.
Mm-hmm.
An extern, for those who don't know, it's kind of like you're a nursing student, but you're getting paid for it. You're not really a nursing
Mm-hmm.
student, but you're kind of like an assistant and you get to learn all your skills
You
and
get
you
to.
you help out on the unit, right? So I did that in a merge and I absolutely fell in love with a merge and I was like, okay, this is where I'm gonna be. So graduated, did my new grad in a merge. I was in a merge for like a total of 14 years, 14, 15 years, I believe. And then in between that 14, 15 year time period, I did mental health, I did med-surg, then I started going into ICU because at that point I was like, okay, fine. I love the fact that we stabilize these patients and who've
Yeah.
had like who've had a code blue and whatnot. But then what happens after? We just
What
ship them to
happens?
ICU, and I don't know
Mhm.
what happens after. And I was intrigued, so I did my ICU certification. Loved that. Got into ICU, and it wasn't until the pandemic, which because I was working both ER and ICU during the pandemic,
Mhm.
so you can imagine how crazy it was.
Mhm.
And during the pandemic, I'd say more 2022, I was like, okay, I'm done with the merge. I'm done. And now I'm in the ICU. And then once I started doing ICU, that's when I realized there's other opportunities, and that's when I started doing clinical teaching,
Yeah.
clinical facilitator, and whatnot. So
Yeah.
that's kind of the whole general gist of how I got into nursing.
Well, listen. So here is the thing, though. You got exposed to the healthcare system and parts of it quite early. And even before you were exposed physically, you were exposed intellectually because of the books your mom had at home and stuff like that. So when you
Yeah.
finally got there, what was the biggest challenge for you?
The biggest challenge for me, um, there were a number of things. One, um, being someone of a visible minority, you're always are having to prove yourself. You're
Mm-hmm.
always are having to prove yourself. And not even just to your staff, but just to patients. I
Mm-hmm.
can't tell you the amount of times where I have walked into a patient's room, especially in a merge, where they either thought A, I was security, or B, I was housekeeping. And I'm like,
Mm-hmm.
which housekeeping or security wears a stethoscope around their neck? Like, come on now. Um, so there's that. And then just also, and then of course, um, The racism and stuff happens more when the patients are either intoxicated or drunk or there's some mental health issues. But usually with those, you can take care of that. But for me, it was always trying to prove myself. Um, but then also too, a challenge is also realizing, what I went through, I don't want others to go through, which is probably why I
Hmm.
got into teaching. Like there were
Hmm.
certain struggles that I went through, like, learning certain tasks, trying to learn certain protocols. And at one point I remember I thought I was not going to be a nurse. I thought emerge is not for me. This is dumb. Let me just
Yeah.
do med surge. And I remember someone, she was at the time, she was an educator, but she was kind of like a liaison. She kind of precepted,
Mm.
and she was like, "No, Dwight, listen, I might come off as hard, but I'm not. I'm hard on everybody. I want you to be the best because I can see a huge potential in you." And her name's Blaine. I'm just gonna say her name because she was really awesome. And yeah, and then at that point, I took that, and then I just kind of took it as my
Yeah.
mantra, and I just grew. I just
Yeah.
absolutely grew.
Yeah.
And but yeah, that was a struggle. Like that, mainly just proving myself. I think every nurse kind of goes through that, but especially when you're a nurse of color, and on top of that too, I'm a man, right? So there's not a lot of
Yeah.
men in nursing, even though it's starting to increase a bit, but there's not a lot of guys in nursing. So you have that stigma as well too. So you also
Yeah.
have to kind of prove yourself, well, I actually am care and gentling and I'm not, this bunch of
Yeah.
stereotypes that you people have,
Yeah. Yeah.
and I know what I'm doing.
Yeah. Yeah.
So,
Yeah. Yeah. One of my struggles along the way was to have people stop referring to men in nursing as male nurses. They're nurses.
mm,
And
yeah.
there's no need to say the male nurses. There's no need to differentiate because they're nurses and they are just as capable as anybody else. That was one of my
Yes.
big things.
I agree with you 100%. Even though I mean, we do play on the name, Nurse or
Hmm.
male nurse just for social media aspects and so forth.
Yeah.
That's one thing too. It's yeah, I'm a nurse. And another thing too, as you're mentioning about that, one of the struggles, not struggles, but one of the things that I always come across too is where you have certain patients who are like, well, I don't want a male nurse. I want a female nurse. And okay, fine for cultures and stuff, I get that. But then
Hmm.
I also tell them, I'm like, okay, but your gynecologist is a man.
Yeah, I
So
know.
you're
If
okay.
you were a doctor,
You're
that wouldn't be an issue.
yeah, I'm a exactly. It's like
Yeah.
you're okay with a male doctor all up in your kibbles and bits, but you don't want a male nurse who's not even who's assessing you and giving you all these treatments. Now, with me, I'm very cautious with that. So, for example, if there's something that involves a female patient where there might be some type of exposure, I always have a female colleague with me.
Yeah.
Always. It's
Yeah.
just for safety because
It's
there's been
just,
situations that, yeah, there's been situations that I know where certain nurses who are men have, then they were
yeah.
wholly innocent, but they got
Yeah.
caught up in a situation and allegations were thrown about that were not
Yeah.
true. So
Yeah.
that's, for
Yeah.
all the guys out there who are nurses, that's one thing I would definitely tell you. If you are gonna like do an ECG or a Foley catheter or anything that involves some type of exposure and it's a woman, make sure you have another female colleague in the room.
Yeah. 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 So, do you see, you're a clinical instructor?
Hmm.
Um, One of the things I saw a lot was students having a difficulty merging the theory and the practice. Once they get into clinical settings, there's a bit of a hurdle there. How do you deal with that?
So, so with me personally, what I do is the way how I usually do is clinical is there for you to learn and to know all your stuff. Okay. It is there for you to be exposed, for you to take what you've learned in the lab and to apply to that. I know when I was younger, back when nursing school, in clinicals, we did that, but then there were like assignments and this and that and care plans and so forth. And don't
Mhm.
get me wrong, care plans are important, and that's something that I do put in my um in my clinical students,
Yeah. Hmm.
but I want them to learn. So when you're asking them to do all these assignments on top of essays and other stuff that they're already doing, they're not going to retain that information. So what I usually tell my students is I'm like, okay, guys, we're in the class, we're in such and such unit. Um, you're gonna be partnered with such and such nurse, and these,
Mhm.
and I want you guys to practice and know all these skills. Oh, you never did a Foley catheter before? All right, let's do it together. Oh, you haven't done this together? All right, let's do this together. Because the thing though is that when you get caught up with theory, and don't get me wrong, theory is very important. Theory does play a huge factor in nursing, but there's also the practical part, and I think
Mhm.
that's where some of the nursing students, they I wouldn't even say they struggle, but they have difficulty because they're so it's so academically based, and it's all theory, 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 that they overwork themselves, and then they forget the practical parts. And also too, whatever you read in your textbook or whatever theoretical stuff you have doesn't necessarily happen in the real life, in the real world, and which is what a
Mhm.
lot of nursing students also realize, because they're like, well, according to to such and such textbook, we're
Yeah.
supposed to do this, and then it doesn't work like that. A, B, C, D sometimes ends up being D, C, A, B, or
Yeah.
A, D. You know what I'm saying? So
Yes.
that's where
Yeah.
that's where clinical comes in, and that's why they need to learn all that.
Yeah.
Um, with me personally, with my schooling, my nursing school was quite interesting because it was a collaborative program. So what that was is that there was 2 years at the college level and there was 2 years at the university level. So the first 2 years was all practical for me. So it was like I learned health assessment, I did all that stuff. And it made a huge difference because I remember,
Yes.
again, on the cardiology unit, I remember me and my group of students that I was with. One of the nurses asked me and said, "What year are you guys in?" And we were like, "We're in second year." And the nurse was like, "How come you guys seem to be more practically inept than these fourth year, almost like
Mhm.
ready to graduate
Yeah.
students?" Because they were from a different school, and they were so theory based that by the time they did their practical, they couldn't do a head to toe properly.
Yeah.
Whereas myself, who was in second year at the time with my other students, colleagues, we're doing head to toe. We're doing all that stuff. So it's like that's why they need to emphasize a lot on the practical. And I think as a clinical instructor, my thing is don't I don't know. Everyone's different, but I wouldn't bombard them on assignments in clinical. What
Yeah.
they should be practicing on is their practical skills, because things can change. Everyone presents different, and this is your learning opportunity. And you can use those practical experiences and then relate those to
Yeah.
other courses that you're doing to write your essays and your theories and so forth on. So
Hmm.
that's
Hmm.
just how I approach it.
Yeah. Yeah. I absolutely agree that that's a huge hurdle for many students. That's a huge hurdle.
Yeah,
So
yeah.
here is the other thing that we're seeing though. We're seeing technology encroach, for want of a better word, a lot in healthcare. It's blowing up. What what do you think you see in the way it influences the way we deliver care in the next 10 years or so?
So with technology, um, there's good things in there, and there's bad things about it. So the good things I will say is, a lot of hospitals now do electronic charting, which I personally like because my handwriting is not the greatest. So electronic charting, able to upload vitals and so forth, and able to
Hmm.
communicate, is it's a lot easier in accessing charts. The problem that I'm now seeing, and this is probably maybe with the new generation, and it's funny because I even learned this when I was doing my orientation to become a clinical instructor, is that this generation's very into their phones and into the technology that sometimes they don't, and it's not their fault, that sometimes they forget how to communicate and when to communicate and what words to use. Because you can say everything all you want on your device, but you're interacting with human beings.
Listen.
You are going to interact with someone who just lost their mother, or just
Hmm.
found out they had cancer, or their loved one just had a stroke and they don't know what to do, or their baby just has some type of like autoimmune disease
Yeah.
and they have no clue what to do. As nurses, we need to know how to communicate. We need to learn empathy. We need to learn how to listen, and not just listen with our ears or eyes, everything like that. Because 9 times out of 10, we're at that person's most vulnerable state.
Yeah.
They are coming to you, or they are at you because they need your help and assistance. And growing up, you know communication has always been important, but now with with devices and texting and
Yeah.
all these type of stuff, it makes it a bit difficult, especially with the new generation now, because they're so into their devices that sometimes they don't know how to communicate properly. And I personally have seen that um in my practice where some of the younger generation nurses, and again, this is no disrespect to the younger nurses because they also provide a vast amount of new knowledge
Yeah.
that us nurses, older nurses or intermediate nurses need to know and strive on. But it's just that communication part. So um that's the part where that's kind of the con. But technology itself, I mean, the stuff that I've seen from like when I started to now has been amazing. It's just it needs to be utilized and again properly and in a way that benefits the patient and also ensures that the patient is being communicated and listened and heard. So,
Yeah. What do you think you would like to see change in nursing life, per se?
oh boy. Okay. Well, the because I'm actually doing because I'm doing a paper on this for my master's. So it's funny you
Okay.
mentioned this. The one thing that I really want to be seen being changed is the workplace violence against nurses. It needs to stop. I don't know why people think that because we're healthcare professionals and we're in the hospital, they could just talk to us any kind of way and be abusive, both verbally, physically, mentally, and emotionally. But it needs to stop. If I were to go to your workplace and if you were to work at, say, I don't know, McDonald's, for example, and if I were to carry on rude and called you out of your name and called you everything but a child of God, I would be kicked out and arrested and even charged. But for
Mm-hmm.
some reason, because a patient is a patient, that doesn't happen.
That
And
doesn't
the
happen.
nurse is always the nurse and the healthcare worker are always questioning, well, what did you do to provoke this situation? I
Yes.
didn't I didn't do anything. I did not do anything. I never told this person to put me in a chokehold. And the problem is as nurses we run into a difficult thing because I'm gonna be honest with you. I'm a very nice person, but if you come to me physically and attack me, I'm gonna react and I'm gonna go into defense mode. Now you can't tell me I'm in trouble and you're gonna charge me for wrestling down a patient when this patient tried to kill me and tried to
Yeah.
like strangle me, right? So I think for me, a lot of there needs to be a lot of education, especially with the public. Like I get it. You're at your vulnerable, you're at your
Yeah.
sickest point and everything like that. And we totally empathize with that. But we're not your punching bags. You don't need to talk to us rude. And I think also too, because nursing is predominantly a female
A
dominated
female. Mm-hmm.
profession, some people take advantage of that. They're like, oh, well,
Mm-hmm.
she's 5'2". She I'll just boss her and tell her whatever she wants. No, because then what ends up happening is that they're gonna get someone like me now who's gonna but no, in all seriousness though, the workplace violence has I don't know if it's because of COVID or whatnot, but it has escalated.
It's
And I
escalating.
and especially with me working in a merge, I've seen it like the amount of stories I can tell you. I've had people do bomb threats. I had one man who basically grabbed a nurse and I was there and I basically had to like stop it. And he basically threatened her and said, he read her name, said, I'm gonna look you up on social media. I'm gonna find you. I'm gonna unalive you. I'm gonna unalive your family. And then when I intervene, and of course, he yelled out racial slurs. And I
Mm-hmm.
just basically just ignored him. And me and security basically had to control the situation. But it's
Mm-hmm.
stuff like that where it's like, why do you feel you can do that, right?
Why?
Like, there's
Mm-hmm.
no need for you to do that. Like, as I said before, you can't go to anyone else's workplace and just do that. The police would get called and we would get charged. So
Yeah.
why is it deemed okay or acceptable for a patient to do that? And then when as a nurse, you try to defend yourself or try to intervene, all of a
Yeah.
sudden it's
Yeah.
what did you do to escalate this? Or what could you have done to prevent this?
Yeah.
Well, we were doing a whole bunch of stuff to prevent this, but it did not work.
Yeah.
So that's kind of like my main that's I'm very passionate about that. And I really one of the things I would love to do um is somehow, and maybe I can put this on the atmosphere, maybe this would work,
Put
is
it out
put
there.
a bylaw. There needs to be some bylaw that needs to be put out there. and it could be national, international, state-wise, province-wise, that says as a patient you cannot do this, and if you do certain things you will get charged. I think that's what needs to happen. I think, and that's why a lot of nurses
Yeah.
too, some nurses drop out because
Yeah.
the
Yeah.
the the abuse and everything is too much for them.
It's too
They
much.
came in
That's
to
what.
help you, not to be beat up.
Exactly. 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 What kind of advice do you give to someone who tells you they want to be a nurse? Because you had the whole gamut. You had the books, you had the exposure, you had the pharmacy thing, and all of that going on. So, what kind of advice from all
Um,
of that?
okay, so first of all, for nursing school, I will say this for anyone who's interested in nursing school. Nursing school itself, it's not difficult. It's the volume of work that they pile on you. Okay.
Mhm.
So I want to stress that out because the work, if you study, you'll do good. But it's not so much you studying and knowing the knowledge. It's just a volume of work that they pile up on you because like every
Mhm.
week you got something due.
You've got.
Um, so what I would say is, I mean, just schedule yourself, time manage yourself. As far as making it through nursing school, use all your tools that you need to do, but also remember, make sure you're in it because you care for people and you like taking care of people. Because trust and believe, the public ain't dumb. If they know that you're in nursing for money, they're gonna see it. And even as me as a nurse, I can tell from a colleague who's really passionate about their job to someone who's just doing it for money.
Yeah.
And you shouldn't do it for money. If you're in it for money, become a businessman. Go invest. Nursing is not the type of career for that. Um, there's some patience. You need to have some patience with nursing. And another thing too with nursing is nursing has such a huge variety. You can
Yes.
do a lot. You don't even have to do bedside. You can do um nursing informatics, you
Mhm,
can do
mhm.
management, you can do work for the government. There's so many things you can do legal stuff. There's so many things as a nurse that you can do. So not and I'm not trying to discourage bedside, which is another thing that I'm going to get into as well too as another advice.
Mhm.
Um there's so many things you can do. There's so many things you can do as a nurse. So don't think
Yeah.
that you're only limited to like being at the bedside. But with that said, for all my bedside nurses, and this is something that's been a bit of a debate, um, for those, especially for my new nurses, for those who want to get into ICU and to emerge or any specialty um area, maybe PACU, maybe not so much peds, and I wouldn't call psych, but I know there's always been this drive of or this thing that's been pushed in social media to like nursing students as, you know, if you want to get into ICU and emerge, just go into. Don't let anyone tell you that you need to do med-surg. Don't let
Mhm.
anyone tell you that you shouldn't do med-surg experience, blah, 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 blah. I'm here to tell you, A, stop bashing med-surg because med-surg is your basically builds your foundation of nursing.
Mhm. Mhm.
Number two, yes, you can go into these fields, but I would strongly advise you to go do med surg. And I'm not saying you need to do med surg for like 10 years. You can do it to like 6 months to a year just to get your feet wet, just to kind of
Mhm.
get your bearings going. The reason being is that when you go into specialties like ICU and emerge or PACU or OR, the expectation is that you should have already had a nursing background and a
Mhm.
nursing knowledge, like
Yeah.
your basic nursing knowledge. They're not going to teach you that. And from what I've seen, especially for some of not all of them, there's some new guys that are amazing, but there's been some new grad nurses who I've seen struggle because
Mhm.
they haven't had that basic knowledge, right?
Mhm.
My thing
Mhm.
is, how can you take care of an unstable patient if you don't know how to take care of a stable patient?
Stable
You
one.
need to recognize the signs and symbols of when a patient goes from stable to unstable in order to, work with someone who's really
Mhm.
unstable.
Mhm.
And
Mhm.
I've seen there was one student who, not student, he was a nurse. There was one nurse that I know who, they started they started in, I think it was ERs. I forget where it was. It might have been, it was ER or something like that. And then they wanted to go into, and they weren't even ER for that long either. I think they went into PACU or something, I forget. And they were overwhelmed because they went from an area. that,
Mhm.
they were in emerge and they weren't even in the advanced part of emerge. They were only doing the basic stuff like
Ah,
casting and people
mhm.
coming in with stomach pains. And then all of a sudden you went to someone who's like intubated and on propofol and all these type of
Yeah,
like,
yeah, yeah,
like
yeah,
sedation
yeah,
drugs. And it was overwhelming. They were like, what is this?
yeah, yeah.
Well, you know what I'm saying? And it's unfair to you and it's unfair to the patient.
It's
So
unfair to the patient. Yeah.
yeah, so I know there's some people who like I said, especially on TikTok and Instagram and whatnot, a lot of the social media nursing platforms, some of them tend to encourage young nurses to don't do med surg, go straight into your specialty. Like I said, like if it's psych or if it's like mental health or public nursing where you kind of don't really need that much base, like you do, but you can those
I
fields you can
get
go
you.
straight into.
I get you.
But but something that's very critical or that deals with unstable patients, I
Hmm.
would personally, my advice is at least do med search for 6 months to a year,
Hmm.
just so you have a basic knowledge, just so you can get your feet wet and you know what's up. Because when you
Hmm.
go to ICU and emerge and those other specialties, there's that expectation that you should already know
A
that.
lot.
And if you
Yeah.
go in as a new grad, you're almost shooting yourself in the foot. But that's just me. Other people have different advices and so forth. And yeah.
Lastly, last question for you. It's
Oh,
a
we're in the
question I
last
ask
question already? Oh my gosh.
all nurses. Last question for you, Dwight. So what do you do? What does self-care mean to you? What do you do to take care of you? With all that you do, how do you take care of Dwight?
Okay, well, first of all, I just came back from the gym. So gym is very important to me and my wife. We work
Okay.
out.
Mm-hmm.
Family time as much as I can. Vacations, hence me going on vacation. And also too, like, I'm at an age right now where me and spas are like this. Like I love a good spa treatment. Like I will go to like a all day spa thing, a
Mm-hmm.
massage, just
Mm-hmm.
relax,
Mm-hmm.
hanging out with friends, chilling out, um, just downtime.
Yeah. So Dwight, thank you. Thank you. Thank you. Thank you. Thank you so much for this conversation. It's been real. I've loved it. I've loved it.
No,
Any last
no
words you want to
problem.
leave us with?
Um, Last words. I don't know. Can I give my social media stuff? Is that okay? Or is that like I don't know?
Absolutely. And you can do that, and I will absolutely include it in the description box as well.
Okay, perfect. Okay, for those who want to follow me, I am on Instagram, Med Soul Brother. I actually have a YouTube page as well too, but I have not been on it for a while, but I need to stop updating it. And I used to do blogs, and nursing newses, and that's
Yeah.
Nurse Soul Brother. Um, I'm also on TikTok as well too, but I'm not on that as much. But if you guys want to follow me there, because I do also post some nursing stuff, and again, that's Nurse Soul Brother. Um, I hopefully my book will come up maybe this year, maybe next year. Look out for that. I'll post it on my socials as well. Um, And that's pretty much it, really. Just kind of, for those who want to get into nursing, you can do it. Don't feel discouraged, especially for my people of color. Prove them wrong. Prove
Prove
them
them wrong.
wrong.
That,
Like we always have the stereotypes, and one more thing I do want to say
yes.
to my brothers out there. What I need y'all to do is we are looking at our sisters out there and they are killing it. I'm working with Black women who have master's degrees, PhDs.
PhDs.
And they're killing it. That needs to be an inspiration to us. And I don't care what kind of field it is that you get into, because I'm finding that a lot of us Black men, we are just encouraged to either do sports or music. We are more than that. We're
Yeah.
more than just entertainment. We are
Yeah.
smart. Go
Yeah.
out there and get your master's and PhD. Don't let anyone tell you otherwise. It amazes me how smart and amazing these Black women. Like I work with so much. It's just like they actually inspired me. A number of them inspired me to do my master's. I had
Yeah.
no intentions of doing it. I already had my two
Yeah.
degrees. I'm like, I'm good. Seeing that inspired me, and I think we need to change the game. We need to show that we are intelligent, that we
Yeah.
have the education, and we can make a change.
And we
So
can.
that's
And
my
we
little.
can.
That's my little. That's my
Yeah.
little script.
And that's the only that's the only way we are going to do it actually. Um,
Yeah.
equip ourselves to be in the rooms that matter.
Exactly,
Yeah,
exactly,
that's what we need
exactly.
to know. Yeah. So, and I'm glad you mentioned your book. I meant to ask you about it.
So writing is one of my hobbies that I have. So the first book that I did, it's called Double Deception, and it's under my author's name, which is Ford D. Barrett.
Mhm.
I'll include that to you.
Yes.
And pretty much, I won't give too much of the details, but it is a mystery suspense novel. You guys could check it out. But writing has always been my passion. I actually, at one point, I was a music and an album reviewer for a website. This was
Mm.
back like a number of years ago. It was what's the name? JustSoul.net. So what it was that we were interviewing and featuring like R&B, neo soul, independent artists. I used to do a lot of like album reviews and interviews with that. Um then I'm currently working on two other pieces. I'm doing an autobiography of myself. This is basically me in nursing and how it came to be and my
Uh-huh.
experiences and my challenges and struggles. And then there's another suspense mystery that I'm working on as well too, so to speak. But then I also had completed another book, which is like a two-part series. That's done. I just have to get that published. But life has been lifing right now. So hopefully I'm able to get that out maybe the end of this year. We'll see. But yeah,
Good for you. Good for you, Dwight. I love it. I love it.
thank
And
you.
what it
Thank you.
shows again is how multifaceted we are as nurses and how all these
Yeah,
experiences that we have, we can use them everywhere.
we could definitely use them everywhere. We could definitely use them everywhere. And I'm really happy. And I really hope that especially my autobiography, um, when that comes out, that I'll be able to get that going because I think it
Yeah.
will also add a very unique perspective, especially as a Black male
Male.
perspective of
Hmm.
nursing and
Yeah.
coming from immigrant parents. So that's going to add more of an impact. So that's why I'm like, I really should get that out very soon, but it's just, I'm writing papers right now. I'm writing like assignments. I just submitted in
I
a
get
paper
you. I
last
get you.
week. So that is a goal. That is a goal.
Dwight, thank you so very, very much for this. I cannot tell
No
you how much
problem.
I've appreciated talking to you. It's been
No,
great.
thank you so much. I really appreciate. Thank you so much for inviting me, and this opportunity was just awesome. And I hope I inspired someone out there.
I'm sure you did. I'm sure you did. Thank you.
Mhm. All right. Thank you so much.